Welcome to the Caesarean delivery room. People are often surprised how small the theatre is and how many people are present. Usually there'll be around 8 members of staff, which sounds like a lot, but they each have their roles to play to ensure a safe birth. In addition to your midwife, the theatre team comprises an anaesthetist and their assistant, up to 3 theatre nurses, 2 surgeons and sometimes a baby doctor. There may also be supervised staff in training. Your birth will take place on a padded, warmed operating table, and your birth partner will be able to sit close to you during the procedure. It's important to monitor your blood pressure throughout the procedure, so you'll have a cuff on your arm inflating every few minutes. Other routine monitoring includes sticky dots on your chest or shoulders to monitor your heart, and a small clip on a finger or toe to monitor your blood oxygen levels. After completing a safety check, your anaesthetist will numb the skin on your hand or arm, then insert a thin plastic tube called a cannula into a vein and set up a drip to give you some fluid. Next, you'll be given your spinal anaesthetic. Many people are very apprehensive about this. Your anaesthetist will numb the skin on your lower back before giving you this injection using a very fine needle. You'll be asked to curl up so that your back is arched. Most people find that after the initial sting of the numbing injection, they just feel pushing in the back. Occasionally, the injection can be uncomfortable, particularly if it's difficult to find the right spot, but most people are surprised how quick and painless it is. It is common to feel a tingling in the back or leg as the needle is positioned in the right place. This is normal and does not indicate a problem. Once the spinal injection has been performed, you'll lie on your back whilst the anaesthetic is taking effect. Your midwife will insert a tube called a urinary catheter into your bladder to keep it empty during the operation. This shouldn't be uncomfortable as you'll be starting to feel numb. This tube will be removed either later that evening or the following morning once the spinal anaesthetic has fully worn off. During the few minutes after the anaesthetic is given, some women feel a little lightheaded or even sick. If this does happen, tell your anaesthetist. It's usually due to low blood pressure, which is easily treated. This feeling shouldn't last long. You may also feel shivery or itchy, both of which are side effects of the spinal injection, but are harmless. Next, your anaesthetist will check to see how high the spinal anaesthetic block has reached, using either an ice cube or cold spray. Once the numbness has reached the required level above your ribcage, there's a further safety check involving everybody in the theatre. Then everything's ready to start your caesarean. Your tummy will be washed with an antiseptic solution and sterile drapes applied. A low screen will separate you and your birthing partner from the lower part of your body. The incision is usually slightly below the bikini line. Once the operation is underway, you'll hear the sound of instruments and the sucking of fluids from around the baby, and you'll probably feel pulling and some pressure, but you should not feel any pain. Occasionally, women do feel discomfort or even pain at some point during the procedure, but this is uncommon. It's important that you let your anaesthetist know if there's anything you're not happy with during the procedure. It normally takes around 10 minutes until your baby is born, but occasionally it can take longer. In the traditional approach to a caesarean section, the screen remains in place throughout the birth and your baby is cleaned and wrapped in a towel before being handed to you. However, we now offer a variation on this that you may want to consider. This involves lowering the drapes once your baby's head has been delivered so that you can see the rest of the birth. This option is not always available, for example with a breech presentation, but you'll be advised if it is in your case. This is called a natural caesarean birth and is the one we've shown in this video. Some people worry that they'll see the incision, but this is always hidden from your view by your bump. We'll discuss whether you want this option with you on the morning of your section. Once baby is delivered, we normally wait for around 1 minute before clamping the umbilical cord, which has been shown to be beneficial for baby. Once the cord is cut, your midwife will make a brief assessment and, provided your baby does not require any extra support, will hand him or her directly to you so that you can have immediate skin-to-skin contact. Most people are keen to photograph their newborn baby. This is fine, but please don't film the staff or surgical procedure itself.